Peace, I am Ivan. This video today is a bit special. We're not discussing theology or Bible studies, but a very practical topic: psychological trauma and healing after disasters. The recent fire in Taipei not only destroyed homes but also hurt the hearts of many Hong Kong people. If you felt very uneasy, sad, or powerless these past few days, please don't blame yourself. When Jesus was on earth, he would cry, get angry, and weep with those who mourned upon seeing people suffering. Today, I want to join you in understanding these trauma responses and learning how to care for ourselves and those around us. The recent fire in Taipei, Hong Kong, burned for over 40 hours, not only destroying property but also hurting the hearts of many Hong Kong people. Whether you're a local resident at the scene or a citizen witnessing it through news footage, if you felt exhausted, unable to sleep, heart racing, palms sweating, or very powerless these past few days, I want to tell you the most important thing first: these reactions are normal. The content of this video references professional guidelines from international authoritative organizations, including the World Health Organization, WHO, American Psychological Association, APA, United Nations Interagency Standing Committee, IASC, and Hong Kong Red Cross Research. This video aims to accompany everyone through these difficult days, explaining how we can take care of ourselves in the coming weeks and prepare for similar events in the future.
If you've been feeling like everything around you is unreal these past few days, experiencing chest tightness, confused thoughts, or even physical numbness, please remember, you are not sick. These are all normal reactions of a normal person facing abnormal events.
If you felt that everything around you seems unreal these past few days, with chest tightness, confused thoughts, or even bodily numbness, remember, you're not sick. These are normal reactions of a normal person facing an abnormal event. Our bodies activate a fight or flight protective mechanism when facing threats. Even after the event, the body might not have shut down yet. That's why in the early post-disaster period, you might feel nothing at first, or symptoms like increased sweating or palpitations appear only after a few days. This is a delayed response, part of the body's defense mechanism in action. Right after the disaster, sweating might increase as the body is still in fight or flight mode. Medically, we call this initial intense reaction acute stress reaction. Common symptoms include rapid heartbeat, shaking hands, sweating, bodily numbness, confused thoughts, and repeatedly replaying fire scenes in your mind. In psychology, these are called intrusive thoughts or flashbacks. You might repeatedly dream of the disaster scene or suddenly feel like you're back at the fire, feeling very real, not just a memory. Some specific symptoms, like phantom smells medically known as phantosmia, where you smell burning or smoke even when there's no fire. Also hypervigilance, where similar sounds make your heart race, or you can't sleep at night despite being tired, with your mind replaying flames. Some people feel paranoid, or even sense heat coming, as if the fire is still burning. These are manifestations of trauma memory flashbacks related to anxiety responses. Here, I want to clarify an important time concept. If these intense reactions appear within 1 to 2 weeks, it's the normal acute stress period, the body's self-repair process. But if these symptoms persist beyond a month and severely affect your daily life, it may require professional assessment to see if it's developing into post-traumatic stress disorder, or PTSD as we often hear. According to WHO research data, after experiencing severe trauma, about 3.9% of the population will develop PTSD in their lifetime. And according to APA research, in man-made disasters like fires, the risk can even double. So, recognizing these symptoms, knowing what's a normal reaction and when to seek help, is very important. When our body faces threats, it activates a protective mechanism called fight or flight. Even after the event has passed, your body might not have shut down yet. This is why in the initial period after a disaster, you might not feel anything, or symptoms like increased hand sweating and heart palpitations might appear several days later. This is a delayed reaction, your body's defense mechanism at work. Increased hand sweating immediately after a disaster means your body is still in a fight or flight state. In medical terms, we call this intense initial reaction acute stress reaction. Common symptoms include rapid heartbeat, trembling hands, sweating, physical numbness, confused thoughts, and repeatedly seeing fire scenes in your mind. In psychology, these are called intrusive thoughts or flashbacks. You might repeatedly dream about disaster scenes or suddenly feel like you're back at the fire scene. That feeling is very real, not just a memory. Now, let's delve deeper into what post-traumatic stress disorder, PTSD, really is. According to the American Psychological Association's APA DSM-5 diagnostic criteria, PTSD has three main categories of symptoms. The first is re-experiencing. This includes flashbacks, where you suddenly feel like you're back at the fire scene, feeling very real. Also nightmares, where you repeatedly dream of the disaster scene. And intrusive thoughts, where fire images keep popping up in your mind. Even if you don't want to think about them, they appear automatically. Phantom smells, like smelling burning or smoke, also fall under this re-experiencing category. The second is avoidance. You might avoid anything that reminds you of the event. Some people avoid news reports, dare not look at fire-related images, or even live in high-rises. You might be unwilling to talk about it, lose interest in surroundings, feel emotionally numb, as if you can't feel anything. The third is hyperarousal. You'll become easily startled, have severe insomnia, frequent rapid heartbeat, body in constant tension. You'll feel danger could happen again at any time, even if reason tells you it's safe now, your body stays on alert. Some experience panic attacks, sudden extreme fear, difficulty breathing, feeling like you're about to die. This state is paranoid, feeling powerless, seeing the world as dangerous, not wanting to go out. Here's an interesting phenomenon called the pink elephant effect. The more you try not to think about fire images, the more you do. In psychology, this has a specific name, ironic process theory. This tells us that coping with these intrusive thoughts isn't by desperately suppressing them, but learning to accept their existence while separating them from current reality. We acknowledge, yes, I have this thought, but remind ourselves I'm safe now. You might ask, I don't live in that building, I didn't directly experience the fire, why do I still feel so uncomfortable? This is called vicarious trauma, or vicarious trauma in English. When we watch disaster footage day and night through news broadcasts, our brains mistakenly think we're in danger too. This not only affects direct victims but also all Hong Kong citizens, even Hong Kong people overseas. Prolonged viewing of disaster images or videos can cause strong anxiety or flashbacks in those not directly affected. Your brain is injured, it needs rest. This disaster isn't just personal pain, it's our entire city's collective trauma. Hong Kong people feel intense pain over unexplained, unjust deaths. This emotional response isn't just individual, it's evident across society. We feel powerless, angry, sad, unsure how to face the future. Many people think that after a disaster, you should immediately see a psychologist to talk or dig into emotions. But according to the United Nations, UN, Rescue Guidelines, there's an important principle: handle practical matters first, emotions later. In the first 4 to 6 weeks post-disaster, this is the psychological first aid phase. At this time, your brain and body are still in combat mode. According to the United Nations Interagency Standing Committee, IASC, guidelines, this phase can be understood as a pyramid. The base is basic needs, and the top is psychological therapy. At this stage, the bottom-level needs, like finding a place to live, replacing documents, ensuring family safety, having food and water, are the most important. During this time, don't rush to force yourself or family to have big emotional outbursts. Because life isn't stable yet, digging into wounds too early can cause collapse. Years of experience show that if basic supplies aren't met, many people's anxiety persists. But once supplies are in place, a large proportion can naturally stabilize. Give yourself time. Settling life first is the biggest help to your psyche. Post-disaster psychological support should first ensure safety and stability. Simple eating, drinking, sleeping, and grounding exercises are often more important than immediate deep probing. WHO Psychological First Aid Guidelines tell us the three most important things in post-disaster support: protect, listen, connect. The key isn't immediately exploring trauma deeply, but first meeting basic needs, ensuring the person's safety and stability. Government and related agencies provide subsidies, temporary housing, document replacement, etc. in this phase to help stabilize life and reduce trauma-like symptoms. So if you're a victim, actively use these resources. If you want to help others, providing this practical assistance is often more effective than any psychological analysis. Now, I want to share with you some stabilization techniques you can do right now. These methods come from the practical frontline experience of two experts and are supported by international professional organizations. First, ensure basic safety and stability. When you see someone affected by the disaster, or if you feel very uneasy yourself, the first thing to do is very simple. Give them a cup of water, ask if they've eaten, find a safe place to sit down. Simply care for them. Are you hungry? Cold? Do you need anything? These seemingly simple, basic actions actually help the person ground themselves. Grounding means bringing consciousness back from trauma memories to the current reality. When you hand them a cup of water, they'll feel the water's temperature and the cup's weight. These concrete sensory experiences remind them, I'm here now, I'm safe now. Next, I'll teach you a very practical grounding exercise. Bring your attention back to your body's senses. Name 3 things you see right now, like the clock on the wall, the tree outside the window, the cup on the table. Then name 2 sounds you hear, perhaps the wind, the AC, distant car noises. Finally, name 1 object you can touch, feel its texture, maybe the chair's armrest, the fabric of your clothes, the floor's temperature. This exercise helps shift your attention from images in your mind back to the present reality. The third technique is box breathing, also called square breathing. This is a scientifically proven method to regulate the autonomic nervous system and reduce the stress hormone cortisol. If you find your thoughts chaotic or panic suddenly hits, you can follow along with me. First, slowly inhale through your nose. Mentally count 4 seconds. 1, 2, 3, 4. Then hold your breath for 4 seconds. 1, 2, 3, 4. Next, slowly exhale through your mouth. Count 4 seconds. 1, 2, 3, 4. Finally, hold again for 4 seconds. 1, 2, 3, 4. Repeat this 4 to 5 times. Focus on the rise and fall of your chest and abdomen and the counting rhythm. Why is this effective? Because it sends a signal to your brain, telling your body, the danger has passed, we're safe now. Whenever you feel anxious, heart racing, or breathing difficult, you can do this exercise anytime. WHO Psychological First Aid Guidelines and the CDC both recommend using such simple stabilization techniques during acute stress. Besides these immediate techniques, the CDC also suggests maintaining daily routines. Even if your mood is low, try to keep eating 3 regular meals, maintain exercise, and stick to sleep habits. It's like after a breakup, even if very sad, you shouldn't lie in bed all day without going out. Maintaining life's rhythm and avoiding sinking into despair is an important part of self-care. The APA also advises against using alcohol to numb yourself, as it only makes the stress worse. Now, let's talk about a common distress many people face: fire scenes or thoughts repeatedly replaying in your mind. Psychological research tells us that handling these intrusive thoughts isn't by forcefully rejecting them. The pink elephant effect I mentioned earlier illustrates this. The more you suppress, the more they appear. So what should we do? First step, name it. When the scene or thought arises, tell yourself inwardly, now I have a disturbing thought. Or, this is an intrusive thought. Don't judge it, Don't blame yourself for having it, just simply acknowledge its existence. Second step, remind yourself of the current reality. You can tell yourself, I'm sitting at home now, I'm in the room, my surroundings are safe. This helps your brain distinguish past event from present safety. This approach separates thoughts from current reality, reducing the feeling of being engulfed by the scenes. Third step, bring attention back to your senses. Ask yourself, what do I hear now? Maybe wind, AC noise, distant cars. What do I see now? Look at surrounding walls, window views, room objects. What do I touch now? Feel the chair's texture, close feel, floor's temperature. This isn't to make you forget those scenes, but to remember, that's a thought, a memory, not a fact happening now. WHO Psychological First Aid Guidelines and Resilience Principles support this method. Now, I want to discuss a very important but often overlooked topic, how to manage your exposure to disaster information. Prolonged viewing of disaster footage increases the risk of vicarious trauma. If you're visually sensitive, seeing flames, thick smoke, or injured people can be particularly triggering. If you're auditorily sensitive, hearing sirens, screams, or explosions might keep you tense. So what can we do? First, reduce visual stimulation. If you must watch news, try dimming the TV or phone colors, lowering the volume, or even sitting farther away. Physical distance can sometimes create psychological distance. Second, understand if you're visually or auditorily sensitive. If images scare you, switch to listening to news or reading text reports. If sounds tense you, mute the audio and just read subtitles or text news. Choosing a suitable information mode can reduce stimulation. Third, limit exposure time. Don't immerse yourself in disaster news 24/7. Set a schedule, like checking news only from 7 to 8 p.m. daily, and rest otherwise. Your empathy is precious, but leave yourself some breathing space. CDC's post-disaster resources also recommend limiting media exposure to protect mental health. Avoid excessive negative thinking, shift to positive actions, like volunteering, to reduce powerlessness. When you feel you can do something to help others, that helplessness and despair will lessen. If you have a friend who's a victim, you might wonder, how should I comfort them? What should I say or do? Two experts give an important reminder. Sometimes, phrases like my condolences or don't be sad can become pressure, even causing secondary harm. Why? Because emotions are messages. Grief and anger are necessary processes for digesting this. Saying don't be sad or be strong denies their feelings, as if their sorrow is wrong or shouldn't exist. This makes them feel they have no right to grieve, often suppressing emotions in those distressed. So, what should we avoid saying? Don't say look on the bright side or it'll be fine soon. Avoid wrote my condolences. Don't say be strong or don't cry. Don't rush to analyze causes or give advice. Don't force them to let go or cheer up quickly. What can we do? It's simple. Hand them a cup of water, sit quietly by their side. Check basic needs. Are you hungry? Cold? Simply say, I'm here with you. Or, if you want, I'm willing to listen. Note, it's I'm willing to listen, not you should talk. Give them the choice to decide when and how much to say. You can also offer practical help, like bringing food, assisting contacts, accompanying to the doctor, handling daily chores, such as applying for government aid or replacing documents. Sometimes, these actions heal more than words. Both experts emphasize that practical actions and companionship often heal more than theoretical comfort. Most importantly, respect their pace, don't force talk. True companionship is solidarity. No need to rush advice or make them get better. Just let them know they're not alone. Hong Kong people are with them. Who research shows social support is key to reducing PTSD risk. This support doesn't need to be professional counseling. Often, simple, sincere companionship is powerful. Many people worry, will I get PTSD? Do I need to see a doctor? Now, let me tell you some clear indicators. First, we emphasize the time concept again. According to the American Psychological Association, APA, and the National Institute of Mental Health, NIMH, PTSD usually means these intense reactions last over a month. In the first 1 or 2 weeks post-disaster, it's called the acute stress period, the body's self-repair process. No need to worry excessively. According to UN guidelines, the first 4 to 6 weeks is the psychological first aid phase, focusing on stabilizing life. But if certain conditions persist beyond 4 to 6 weeks and severely affect your daily life, that's your body sending a distress signal. You need to seriously consider seeking professional help. The first red flag is functional impairment. If you're completely unable to work, go to the office, interact with people or maintain relationships, care for family, with daily life greatly deteriorating, even basic self-care impossible, this is severe impairment. The second red flag is disrupted body clock. If you have severe insomnia or extreme sleep difficulties, obvious changes in appetite and weight, with no signs of improvement persisting. The third red flag is persistent flashbacks or hallucinations. Even in safe places, you feel like you're back at the fire scene, the feeling intensely real. Or you constantly smell burning or smoke, feel heat, unable to control these intrusive thoughts or sensory experiences, affecting normal life. The fourth red flag is severe emotional issues. If you have self-harm or suicidal thoughts, or persist in extreme sadness, anger, despair, unable to escape on your own. If these persist and severely impact daily function, seeking help from a psychologist, counselor, or psychiatrist isn't just important, it's a brave step. APA's treatment guidelines say early intervention can help about 40% recover within a year. 90% of trauma survivors can recover, but on one condition, you must be willing to grab the rope extended to you. No matter how desperate you feel or don't want to trouble others, use your last breath to seek help. This isn't weakness, it's survival courage. That rope is professional psychological support services, hotlines, counselors, social workers, volunteers. They're ready to catch you anytime. So, don't see seeking help as weakness. On the contrary, it's taking responsibility for yourself. Who recommends effective treatments like trauma-focused cognitive behavioral therapy, TFCBT, prolonged exposure, PE, cognitive processing therapy, CPT, and eye movement desensitization and reprocessing, EMDR. These are proven effective by extensive research. If you need professional treatment, ask your psychologist or psychiatrist which suits you best. If you're in Hong Kong and need immediate psychological support, here are some specific available resources. The first is the Post-Crisis Counseling Network, PCCN. Their hotline is 5181-5501, operating daily from 8 p.m. to 11 p.m. This is a free hotline with professionals providing assessments and, if necessary, referrals for free treatment services. All citizens can use this service. The second is the Hong Kong Red Cross Psychological Support Service. You can contact them via WhatsApp or appointment at 5164 5040. You can also reach them on Telegram at @Talk. Or visit their website www.redcross.org.hk, which has detailed service information. They also have a Shall We Talk psychological support page offering various resources. The third is the government's one-stop psychological support information platform. You can call the 18111 mental health support hotline. The government has integrated various services on the shallwetalk.hk website, where you can find 24-hour hotlines and other service info. The fourth resource is Treehole HK, providing free voluntary psychological services. They've also developed a free mental aid app called Mind Forest that you can download and use. The fifth is the Hospital Authority. You can call 2466-7350 to inquire about their disaster psychological support services or seek help at psychiatric outpatient clinics. If you have an emergency and feel you might harm yourself, immediately call the Samaritans Hong Kong's 24-hour hotline at 2896-0000. Additionally, consider the mhGAP type mental health relief fund. If you want to support long-term post-disaster psychological work, you can donate to these organizations to help them continue providing services. Besides local Hong Kong resources, there are international professional guidelines to reference. WHO has psychological first aid guidelines, CDC has post-disaster coping resources, APA has PTSD treatment guidelines, NIMH has materials on coping with traumatic events. These are available online, and we'll put the links in the video description. WHO's mhGAP guidelines particularly emphasize that early treatment can aid recovery. Don't wait until symptoms become very severe to seek help. The earlier the intervention, the greater the chance of recovery. Now, I want to talk to you about a bigger level, collective trauma and post-traumatic growth. This fire may have destroyed homes, but don't let it destroy your future. Hong Kong people feel intense pain over unexplained, unjust deaths. This emotional response isn't just individual, it's evident across society. We feel powerless, angry, sad, unsure how to face the future. That's collective trauma. But psychological research tells us something important. Post-traumatic growth is possible. According to psychologists Tedeschi and Calhoun's post-traumatic growth model, after trauma, we may gain positive changes in several areas. First, enhanced personal strength. After such trauma, we might discover we're stronger and more resilient than imagined. Second, deepened interpersonal relationships. In shared pain, we may build deeper connections with family and friends, better appreciating each other. Third, appreciation of life. After death and loss, we may cherish each day more, understanding what's truly important. Fourth, new possibilities. Some discover new directions and meaning in life post-trauma, like volunteering, pushing social reforms, or developing new interests and goals. Fifth, spiritual or philosophical growth. We may gain deeper reflections on life, the world, and humanity. The importance of seeking justice, participating in investigations, demanding truth, pushing systemic reforms, these actions are what psychology calls meaning-making. When we transform pain into pursuing justice, turn loss into societal contributions, that's a healing process itself. Transforming trauma into growth and pursuing justice helps us move forward. Here's something to emphasize: maintaining daily routines, continuing to eat, sleep, even appropriate entertainment, isn't callous or forgetting. On the contrary, it's to reserve strength for the long road, to seek truth and justice for the deceased. Care for yourself to have energy to care for others, change society, and pursue our values. Avoid excessive negative thinking, shift to positive actions, like volunteering, to reduce powerlessness. When you help others through real actions, you'll find you're not powerless. By transforming pain into care for those around us and persistence for justice, we can move toward collective healing and transformation. This isn't forgetting pain, but finding meaning in it, strength in loss. Two experts have seen countless disaster zones. Their shared observation, unity, seeking help, practical actions help us gradually recover. Now, let's review the key points discussed today. First, remember that your reactions are normal. Rapid heartbeat, sweating palms, confusion, repeatedly seeing images, smelling burnt smell, these are normal responses when facing abnormal events. Don't rush to label yourself as mentally ill. Second, address the facts first, then your feelings. In the first 4 to 6 weeks after a disaster, the most important thing is to stabilize basic needs. Find a place to stay, renew documents, ensure 3 meals a day, take care of your family. Give yourself time to let life settle down. Third, you are not alone. This is not just your personal pain but a collective trauma for our entire city. Vicarious trauma teaches us that even if you're not on the scene, you may still feel hurt. Many people, like you, are experiencing these pains. Many are willing to support and accompany you. Fourth, manage your media exposure. Limit the time spent watching news, adjust the mode of receiving information, and give yourself space to breathe. Your empathy is precious, but you also need to protect yourself. Fifth, seeking help is a brave act. 90% of post-trauma patients can recover, but the key is that you must be willing to grasp the rope offered by others. If symptoms persist for more than 4 to 6 weeks and seriously affect your daily functioning, do not hesitate, seek professional help immediately. Whether it is the Post-Trauma Psychological Counseling Association's 5181-501 hotline, the Hong Kong Red Cross's 5164-5040, the government's 1811 Psychological Support Hotline, Treehole Hong Kong, or the Hospital Authority, there are professionals who can help you. Sixth, healing takes time. Do not force yourself to get better quickly, and do not blame yourself for not being well yet. Give yourself time, give yourself space, and allow yourself to experience various emotions. Seventh, we are Hong Kong people, and we will get through this together. Through mutual support, through the pursuit of justice, and through transforming pain into action, we can not only survive but also grow, transform, and become stronger. No matter how hopeless you feel, please use your last breath to grasp that rope. That rope is professional psychological support, the people willing to accompany you, and the hope that allows you to keep going. If you need help, please contact professional support immediately. Matthew 11 verses 28 to 30, "Come to me, all you who are weary and burdened, and I will give you rest. Take my yoke upon you and learn from me, for I am gentle and humble in heart, and you will find rest for your souls. For my yoke is easy and my burden is light." This passage is not about immediately getting better, but about Jesus saying, you can lay down your burdens. He allows you to be tired and weak. Healing takes time. God, through professional counselors, doctors, and brothers and sisters around you, becomes your support. Seeking help is not a lack of faith, but accepting the help prepared by God. If you want to learn more about post-disaster psychological support, or if you have friends around you who are experiencing trauma, feel free to leave a message below or share your needs with us. If you or someone around you needs immediate help, remember, Post-Disaster Psychological Counseling Association 5181-501, Hong Kong Red Cross 5164-5040. Seeking help is a brave act. Thank you all for your support. If this video is helpful to you or someone you know, please share it so more people know they are not alone. You are also welcome to subscribe to this channel, turn on notifications, or support us on Patreon to continue creating meaningful content like this. May God's peace be with you. Let us support each other in pain and experience God's grace in weakness.